Okay, so I'm here with my mom. Mom, say hi.
Hi.
Who are you and what do you do?
I'm Dr. Agni Thakur. I'm a cardiologist at St. Francis Hospital, and I'm also the Chief Medical Officer for the Catholic Health Medical Group, which is our physicians across 6 hospitals.
Okay, cool. And then obviously I know you've been working all throughout COVID. So from your current experiences, what changes have you seen in the health system because of COVID-19?
Well, I think at the very obvious level, there's just a lot of changes when patients come in through the door of any healthcare provider's office or urgent care or hospital for any reason. In the past, we weren't checking temperatures, we were not checking pulse oximetry, we weren't having patients sort of speak to their recent travel history on every kind of port of entrance. But now we have very strict protocols in place to make sure that we're screening everybody who walks through the door. So that's sort of the first and most obvious change. Everyone is expected to wear a mask at all times, both healthcare providers and patients families. We've also really limited family presence in healthcare areas. So in the past, like many people in the family could be visiting patients, could be in and out of patient rooms. A lot of that is much more restricted. Actually, during the surge back in the spring, when we had a really, really high volume of COVID patients, even women who were giving birth to babies had very, very restricted access to family, which was actually very difficult for them at the time.
Do you think that those kind of changes will stay around for a long time? Like, do you think they're going to get lessened throughout the winter? Do you think they're kind of going to stay?
I think for the imminent future, we're going to see the same screening protocols remain in place. I think health systems recognize that patients and families need to be together during healthcare. And it's kind of a sensitive and an important time for a lot of people. So I do expect that, and we have already shifted some of those stringencies around visitors and stuff. But again, a lot of the rigor that we implement with these protocols is a function of how much COVID is in the society. So we could loosen up the guidelines in the summer when our percentages were very low, but as things started to kind of tick upwards and we started seeing more and more COVID cases come through, we had to become a little bit more strict again. But to answer your question, I think in the imminent future, we're going to be seeing fairly strong screening protocols in all healthcare arenas.
Yeah, that makes sense. And then I know something else that was introduced during the pandemic was this concept of telehealth and virtual medicine, which is obviously, I feel like for our generation, something that we could really connect with because you could just check in with your dermatologist or something virtually. But do you think that has a future, or do you think it's too difficult for especially older patients and stuff?
So, interestingly, I think it has a very strong future for a couple of reasons. The first is that it's getting reimbursed very well through the Center of Medicare and Medicaid. So CMS, which pays our government payer for a lot of our patients, our main insurance for a lot of patients, is actually covering these types of services more and more because they see real value there. You're absolutely right that it is sometimes challenging to navigate the technology for our older patients, but interestingly, our older and more vulnerable patients are the ones who probably benefit from it the most. If you imagine a sicker older patient who doesn't have the ability to drive, in many cases patients don't have a car, they're coming from our more socioeconomically disadvantaged populations that are not necessarily older, but they have other barriers to accessing care. And these patient populations really benefit from being able to connect with a physician or a healthcare provider from their home. So what we've been doing is trying to adapt the technology to make it easier and easier and more patient-friendly. And the platforms that were initially launched during COVID, nobody expected them to be needed in such a significant way so quickly. It was expected to be something that would evolve slowly over time. And then we went into this pandemic and suddenly everyone needed access to their doctor through virtual health.
Right.
So, you put 70 and 80-year-old people, many of whom are not as tech savvy. Interestingly, some didn't even have a smartphone. In my case, I had to work with a lot of physicians and patients to work through this program. And then suddenly said, get on your app and, see your doctor. And it was hard. But these platforms are getting kind of streamlined. Patients have had an opportunity to come into the doctor's offices in between. So we've been able to show them how to use it and show their families how to help them and show they have aides sometimes working with them at home that can help them. But we are working very hard to make sure that all of our patients become connected to our offices. And I think virtual care is here to stay.
Yeah, no, that's awesome. I think even on like a patient level, definitely it's really great that the health systems are trying to work with the patients to make sure they're able to access care virtually. And then I remember you even telling me about how the health systems themselves have to adapt and reform to make virtual medicine a possibility. Like your computers didn't even have cameras and stuff in the beginning.
Actually,
you guys had to all get cameras. And so
when we first went into virtual care around April, most of the physicians didn't really use Zoom for any reason. I mean, Zoom was not part of our everyday life.
Right, yeah, Zoom was so new.
Cameras were not needed. I mean, we saw our patients in person. We talked to doctors in person in the hallways or on the cell phone. And so suddenly I had to see how all of our practices, we have about 400 plus physicians who overnight needed to get on virtual care.
Yeah.
And most of them had no cameras on their desktops and didn't have the Zoom app downloaded even to their phone. And so it was quite a challenge to kind of like flip it so quickly.
Right.
But every health system, I think, had some version of this. And over a period of time, I think everyone got through it. But it was kind of touch and go for a little bit. It was interesting.
Yeah, no, I think it's really inspiring how the pandemic has kind of created this long-term shift into ways for patients to access care that have barriers at first during COVID, and even patients that are going to have barriers after COVID to coming into an office. Now they're able to access care, and it kind of forced the issue in a positive direction, especially for the older generation of doctors and patients both.
Yeah, absolutely. And I think interestingly, to kind of take it to another level, for these visits to be more meaningful, it's important if patients can give us some information beyond just how they're feeling and what their medications are. So what we've been starting to do is outfit patients with monitors at home for their blood pressure, for their weight, for their blood sugar, even for their pulse ox. And so, the things that you would normally check on a patient when they come into the office, they can almost self-check it at home. And
Right.
we have access to that info, and it enables us to be better doctors in the visit, because we can kind of understand what their parameters look like, and we can adjust their medical treatment accordingly.
Oh yeah, I didn't know that. That's kind of cool. Like everyone's getting in this time of like extreme vulnerability in COVID being so prevalent. People are actually getting to take agency over their own health care, even from their house, and patients are really getting a better understanding of how kind of the system works and how they can take care of themselves, especially because staying at home is so important, and this just kind of translates to that. They have to be their own doctors in some ways.
Yeah, they have to be active participants in their own health care. And honestly, we've seen that whenever patients are engaged in their care, we see better outcomes.
Right.
It's really when patients are unengaged, don't follow up, don't see their doctor, don't do what the doctor asked them to do, that typically the outcomes are not what we would like to see.
Yeah, no, that's kind of another part of the pandemic that I think has made good change, that now everybody feels like they have to take real ownership and control of their own health. And I think from a doctor's perspective, that's, as you said, a really nice thing to see.
It really is, actually. And you see their healthcare providers are finding that their patients' families and support systems are also becoming more engaged because they have to.
Right. Yeah, no, because it's everyone's in such a vulnerable situation. When life's at risk, it really requires everyone to work together. So, yeah, that's really inspiring, actually. Just one kind of final question is, how do you just think that this whole situation, the pandemic, will shift the structure, performance, and role of urgent care versus hospitals or private practice? This is a conversation we have a lot because we know that urgent care has been on the up and up, and they're kind of becoming the future of medicine, but obviously patients have a very special connection to their own family doctors, the doctors they've been seeing for a long time. So do you think that this pandemic will push healthcare in one direction or the other? Will urgent cares continue to become more popular because of this?
I think the overall trend of healthcare before the pandemic was to move things that don't need to be in a hospital outside of a hospital. And that's because non-hospital locations of care are easier accessible to patients. There's a lower risk in certain instances of developing, other nosocomial, we call it hospital-based infections, because you have very sick patients in the hospital. And also they're much more affordable. So a hospital stay is far more expensive than an office visit or an urgent care visit. So if a patient really doesn't need to be in a hospital for something that can be handled in an urgent care or in an office and then taken care of at home, that's really a better way to control costs of care. And as you know, in this country, cost of care is a big issue because our health care is extremely expensive in the United States.
Right. No, definitely.
So I think, from the pandemic, what you're seeing is patients really, when they're sick and they need urgent care or imminent care, they access it wherever it's most easy for them. And typically urgent cares have been an easier place for patient access than emergency rooms. So we did see a lot of COVID coming in through the urgent cares. Problem is, a relatively healthy person can be managed in an urgent care and can go home. A sicker patient really needs to get into a hospital. So what I think ultimately will happen with the pandemic is there will be the same trend that we saw before the pandemic, which is shifting things away from the hospital towards practices in urgent cares. I think urgent cares are going to continue to grow, frankly, because they filled a major need during the pandemic.
Definitely,
COVID testing, antibody testing, and seeing large volumes of sick patients quickly in all hours of the day and night was a service that was really needed, and the urgent cares kind of filled that hole. And so I don't see them going away after this pandemic. I actually see them continuing to be a significant component of our healthcare sort of options. What I see is hospitals looking to either incorporate urgent cares into their network.
Oh, that's interesting.
Or alternatively, partner with urgent care systems in the community that they can kind of develop a joint venture or something with, because the more integrated the care delivery model, the better, which means if a patient goes to an office or an urgent care or a hospital and their medical record is accessible to everybody,
everyone has it instantly.
Everyone knows what happened where. The doctors are able to communicate instantly. We're not trying to fax or email or wait for a pigeon to bring records over to us.
Yes.
It enables us to care for patients better. So I think we're moving towards integrated care delivery models where you have urgent cares, offices, and hospitals that are all largely part of one network, and patients can access the care they need in the place that makes the most sense for them at the time.
Right. That's an interesting proposition. I mean, urgent care is partnering with hospitals and health systems. It's kind of not been really seen that much before, but I think a great effect of the pandemic would kind of be shifting those relationships, because it is all one healthcare community, and patients, their urgent cares, their hospitals, and their practices should all be part of the same treatment, and they should all have the same access to records like you were saying. So that's really cool. Okay. Thank you, Mom.
You're welcome.